Good day, folks. Alfie Vente here, once again, of Vente Pain Relief Clinic and VPRC.ca. I'm hoping you are having a bombastic day. In this video, we're going to talk about 8 locations where fascia can become tight and cause pain somewhere else. So for those of you that have had issues with the fascia, you'll be able to understand this video better than most. For those of you that have chronic pain and tightness and it's stubborn, long-term, long-standing, it might be that your fascia is the issue. You might be questioning what's going on with me, and I'm here to tell you that it could be your fascia. So we're going to talk about 8 locations, and these aren't just isolated to 8 locations. There's a lot more locations. These are just common ones that I've seen in the past and that I've seen consistently in terms of if I loosen a particular area, I get a certain result. So we're going to talk about that. For those of you guys that don't know, fascia is the connective tissue underneath the skin. It wraps around muscles, bones, organs. It connects everything together. And when it becomes dysfunctional and tight, it can cause a lot of problems, particularly chronic pain and tightness. So we're going to talk about these 8 different locations. So fascia connects, as I mentioned, fascia connects everything together, right? It runs up and down. It runs deep. It runs wide. At times, like you can have a fascia that is very tight in one section, just like these diagrams that I have here, and it can actually impact somewhere else. I've seen that so many times. It's kind of like trigger points, but this is more to do with the connective tissue as opposed to the actual point itself, although there could be some connection with the trigger point and the fascia. So right now, these are 5 pictures that I have here. And as I mentioned before, you can have tightness, in one particular location, but it can actually cause issues somewhere else. So here are these examples. The first one that I have here is the circle. The circles indicate where the fascia can become super, super tight. Oftentimes, what happens is that somebody comes in and their neck is very sore. It's very tight. I work on it. It doesn't seem to be giving. What I'll do is I'll check the forearm. So this area that I've circled is actually this area here of the forearm, particularly down here around just above the wrist. This is actually an acupuncture point that I also use when I'm working on releasing someone's neck. I'll use it at times. So this section of the forearm, when it's really tight, sometimes it gets so wrapped. It gets so wrapped, particularly for those of you guys that are on your computers typing away for long periods of time, that I have to pry away. It takes like 15, 20 minutes for me to release the area. But when it does get released, when the fascia becomes released around this section here, what I found over time is that the neck and the shoulders seem to release. So, after I've worked on the neck and it seems to be not giving, I'll go to the forearm, and when I release that, I'll go back and I'll notice that there's a lot more give. Generally, the person will say, wow, my neck feels a lot better. The second one here is the lower back fascia. So this is actually, this whitening section here is called the thoracolumbar fascia. It's not quite the fascia that we're talking about. The thoracolumbar fascia is a form of connective tissue. It's kind of like tendinous tissue. But over top of that, the fascia can become very, very tight. And when that happens, somebody could come in and they could be complaining about hip pain and hip tightness. When I work on that area, what often happens is that there's a release. You can see with the blurring, the yellow blurring here or the orange blurring. I'm not very good with colors. It can relieve some of the tension around the hips and the glutes. That's a very, very common one. In fact, generally, if the hips and the glutes are tight, you'll find that the back is also tight too. This one here, for those of you that have postural problems and neck problems, maybe headaches, I've circled there, the front there, the chest. When the fascia around the pectorals becomes very, very tight, what happens is your neck gets pulled forward. In fact, if your neck is forward for a prolonged period of time, the fascia becomes tight and it's harder for the person to pull their neck back. And then what will happen is that the person will be complaining about neck pain, potentially headaches because of their bad positioning of their neck. So what I often do is I work on the pectoral fascia, this area here that's circled, and not to mention also the front of the neck. So when I release the front of the neck and the pectoral fascia, there seems to be a lot more release of the muscles around the neck. They can move. People can move their neck better. Their headaches tend to feel a lot better also. And also, it can help pull the shoulders back because I've relieved the tension around the front side here. The next one here, you can see here, this is kind of like right where the trapezius is. This is a segment of the spine called cervical segment C7. So it's part of your neck. And this section here, when it becomes really tight, it can cause a lot of pain up the neck, into the head, and into the shoulders. Typically people will work on the base of the skull, maybe the back of the neck, and also the shoulders, but kind of they'll work maybe a little bit around that section. Myself, I'll pull and tug on it to relieve the tension in that area. In fact, what I found is people with really, really stubborn neck issues, stubborn headaches and stuff like that, this area becomes very, very thick, and I can actually feel like it's like a chunk of tissue that's really, really stuck together. And what I do is I pry away at it and relieve it, and it tends to help relieve the person's neck issues. So the last one there, at least in this set of pictures, is the calves. This one is a fascinating one. I've circled the calves there, and you can see where I blurred it. The blurring is around the lower back and around the glute area, glute and hip. So somebody comes in and they've been complaining about really, really tight hips, lower back pain and discomfort. And again, they've had treatments, to the back and to the glutes, but it seems to help a little bit, but doesn't seem to be long-standing. I will look to the calves, and what I'll find generally is that the calf fascia, the fascia on the calf, is very, very tight. So I pry away at it. It's not the most comfortable treatment, for sure, guaranteed, because the calves are very, very sensitive, especially if it's very tight. So what I'll do is I'll take 20 minutes or so, 30 minutes to relieve the tension around the calf. And I'll notice that the tension around the lower back and the hips and the glutes become a lot more decreased. So I'll actually feel with my hands, and I'll notice that there's a difference between before I've treated the calf to after I've released the fascia around the calf. So let's go to the next ones. It can cause, let me just move my head here a second so you guys can see better. It can cause local pain and dysfunction, along with pain and dysfunction away from the symptomatic area. I probably mentioned this earlier. So these are more of these locations where the fascia can become tight and cause issues elsewhere. And when I release that area where the fascia is tight, there's a positive effect that I've found over the years. So the first one there, these two pictures, I've circled the bottom of the foot. Now, here's the thing. This is one of those areas that often gets ignored when you're treating someone. For some reason, it's not one of those things where we'll look to see if there could be a possible issue. But for myself, if I notice that this person's had long-standing issues, I want to check different areas. And one of these areas is the bottom of the foot. Oftentimes what I've seen is that the foot becomes so tight that when I pry away at it, the tissues it feels like it's literally glued to the bones of the foot, as weird as that sounds. And oftentimes what I'll notice is that the digits become kind of stuck together, compressed. And when I release the fascia in that area, there seems to be a lot more movement, a lot more freedom of the foot. So when I release the fascia of the foot, the bottom side of the foot, what I've noticed is that it actually relieves tension up the chain. So the calves, the hamstrings, the glutes, especially for those of you that have had issues with long-standing issues down the leg. It could be that the bottom of the foot, the fascia is very, very tight. Just sort of like an aside, with people that have played a lot of sports where maybe you've had little injuries, but you continued on playing. For example, maybe you were a dancer, you had maybe a slight injury to the foot, but you still continued dancing, particularly those that are competitive, maybe a gymnast, soccer players. You may have little nicks here and there when you're playing, but you just continued on. What happens is that you can have scar tissue in the area, and that can cause potential issues with the fascia. When I release the fascia of the foot, the bottom of the foot, again, what I've noticed is that up the chain from the calf, the hamstrings to the glutes, and potentially the lower back sometimes, there seems to be a lot more give. The next one here that I have is the abdominals and rib cage. This is a pretty cool one. Because for one thing, when I release the fascia of the rib cage and the abdominals, the person actually feels better when they're breathing. They feel like they can take a deeper breath in. So somebody who has, for example, anxiety, this is very helpful for them, especially if they tend to not breathe fully. But from strictly from a muscular fascial perspective, when I release this area, the abdominals and rib cage, what I've noticed is that there seems to be a lot of the tension in the mid-back relieved. And the reason for that is that when the fascia becomes tight, because of your posture, maybe you're on the computer and you're kind of slouched over, and when these tissues become tight, what happens is it's a lot harder for the muscles in the back to pull you back into a proper position. They work a lot harder. All of a sudden now you're getting pain and tightness in the mid-back. So that's a key area there to work on, especially if you have a chronic mid-back type of pain. Finally, this one here. The adductor group, or the inner thigh, the area of the inner thigh, when the inner thigh becomes really tight, when it becomes fascially restricted, and I release the area, what happens is that I get a response on the outside of the thigh. So this is kind of like the top part, but actually it's down the thigh, kind of almost around the IT band area, the lateral quadricep. So it's kind of weird in that, like, I'm working on this area to relieve the tension on the opposite side. This is consistent. I've done this with enough runners to see that there's a response on the outside of the thigh. So what can happen is that you can have an IT band issue, for those of you runners, for those of you cyclists that may have encountered this, and you've had IT band treatments. Maybe your glutes are treated, the side of your thigh was treated, and it's painful as heck, as you guys know. What I found is this is kind of like a shortcut. I actually work on this to help relieve the outside of the thigh, kind of like the IT band area. So those are 8 locations where the fascia can become tight, but it can refer to other areas elsewhere. So from my standpoint, again, these are just 8 locations. There's more than that. And sometimes I get some weird ones. But those are the common ones that I've seen over the years. And consistently, I've seen these responses. So if you have stubborn chronic pain, it could be because of your tight fascia. Just so that you're aware of it. Sometimes what will happen is that you get more of a muscular type of treatment. And what I mean by that is that, you're going to get more kind of digging into the muscle, trying to get to release, maybe more stretching, when in fact you actually need more pulling of the tissues. And that's what I do with the fascia. And it sounds uncomfortable because it is, especially if it's really tight. Now, just as a reminder, I haven't given this reminder in a while. We also have our pain relief fitness site, vprc.ca. This is where there's tips on managing your pain for on an everyday basis, using pressure points, stretches, fascial techniques, so on and so forth. So you can go on vprc.ca and find some tips for managing your pain throughout the day. So notes about treatments to the fascia. It can be very painful, as I mentioned before, and this can be based on how chronic the issue is, how tight the area is. It can be very stubborn. Trust me, like I've seen areas where I've worked on, for example, the rib cage, the lat area, the lower back, where it's like I'm trying to pry away at these things and it's not giving. And that sounds painful because it is. It's literally like kind of the tissues are really adhered together, glued. And what I'm trying to do is I'm trying to get the tissues to move better, to get unstuck, basically. Treatments and areas to be treated can be treated from 15 minutes to an hour. I've done like an hour treatment on fascia. Sometimes it's a full body thing, and those can be obviously quite painful because it's generally all over. And what I found is that people who tend to be more anxiety prone and have a lot of stress, their fascia tends to become a lot tighter than most. And I'm going to differentiate that from muscles because what happens is that in rehab, we put muscles and fascia together generally. But for myself, I know that I can isolate the two. Isolate meaning that, for example, it could be like 70% fascia that's causing the issue and 30% muscle, 60-40, so on and so forth. So I base my treatments based on what I'm feeling with my hands. You will generally, I apologize for the misspelling there, you will generally feel more sore relative to regular massage rehab treatments. This is after the fact. Sometimes it's 3 days, sometimes it's 5 days. Generally, though, if you're fit, if you're active, the soreness fades away a lot faster. But that's generally based on how tight the areas are and like how much fascial work we did on you. If successful, treatments results are usually more prolonged. So with fascia, if I'm working on it, if it's the correct spot that we're on, and I relieve the tension there, there seems to be, for me, observable, and also observable not just by me but by the patient, that it seems to be more long-standing than, say, just working strictly on the muscle itself. Just that focus on the fascia can be a big game changer. Thank you for watching. We appreciate it. Please like, share, subscribe, and pass this on to those that you feel this might be helpful for. We want to thank you way in advance. Also, follow us on our social media. And again, we have our Pain Relief Fitness site. Go visit that for pain relief tips at vprc.ca. You can contact us at 416-644-8894. That's our number at our downtown Toronto Financial District, King and Bay, First Canadian Place location. You can also email us at admin@ventepainrelief.com. Once again, my name is Alfie Vente of Vente Pain Relief Clinic and vprc.ca. Again, have a bombastic day, and we will see you in the next video. Thank you very much. Take care.